Does hysteroscopy help diagnose chronic endometritis? Imagine being able to see inside the uterus without surgery. That's what hysteroscopy offers. It allows doctors to look directly at the uterine lining and spot signs that might suggest chronic endometritis, or C. C is a subtle, ongoing inflammation of the endometrium, often linked to fertility issues like recurrent miscarriage or failed in vitro fertilization cycles. Because it can be silent or show vague symptoms, diagnosing C can be tricky. During a hysteroscopy, the doctor inserts a thin, lighted instrument through the cervix into the uterus. They look for specific features that could indicate C. These include tiny protrusions called micropolyposis, which are just 1 or 2 millimeters in size, swelling or edema of the tissue, areas of increased blood flow that appear red or hyperemic, and sometimes a pattern called the strawberry aspect, where red areas have a white central point. These visual clues are quite helpful because studies show that hysteroscopy has a high sensitivity and specificity for detecting C, meaning it is good at identifying those who have the condition and ruling out those who do not. However, hysteroscopy alone isn't enough to confirm C. Sometimes, these visual signs can be misleading, leading to false positives. That's why doctors often recommend taking a small sample of the endometrial tissue during the procedure for laboratory analysis. This biopsy is examined under a microscope, and special staining techniques are used to look for plasma cells, which are a hallmark of C. The presence of plasma cells, especially when identified with CD138 immunostaining, confirms the diagnosis. From a fertility perspective, diagnosing C is very important because, if left untreated, it can interfere with embryo implantation and increase the risk of pregnancy loss. Hysteroscopy is often part of the overall evaluation when fertility issues are present, helping to identify and treat uterine abnormalities that might be affecting conception. It can also be used in surgical procedures to remove polyps or other uterine abnormalities that could impair fertility. In summary, hysteroscopy is a valuable tool that can help identify signs of chronic endometritis through direct visualization. But because it is not definitive on its own, combining hysteroscopic findings with a biopsy provides the most accurate diagnosis. This combined approach helps guide effective treatment, often involving antibiotics, to improve the chances of a healthy pregnancy. Always remember, if you suspect C or are facing fertility challenges, consulting a healthcare professional is essential to get personalized advice and appropriate care.